Ladies and gentlemen, thank you for inviting me to talk to you today about IVF for PGT for Fanconi Anemia and HLA matching. I'm Ilan Tur-Kaspa from the Institute for Human Reproduction in Chicago. And we'll talk about IVF or pre-implantation genetic testing for HLA. So is there a need for it? So if we look at the natural history of Fanconi anemia, there's a progressive bone marrow failure that occur early at the median age of 7 years and in nearly all by age 40. Both hematological and solid malignancies may develop, and genotype-phenotype association for bone marrow failure and malignancies have been identified. And patients with some specific mutations demonstrate a higher incidence and more rapid emergence of bone marrow failure compared to other groups, with a median age of 2-3 years rather than 7. And then also may some develop leukemia without even preceding BMF before the age of 6 or 10 years old. So to date, the only curative therapy for the hematologic aberrations of FA is hematopoietic cell transplantation. About 70% of patients in need of hematopoietic cell transplantation do not have a suitable donor identified in the family or in donor registries. An HLA-related donation compared to HCT with an unrelated matched donor have higher overall survival, less risk of graft versus host disease, and less infections and treatment failure. And in a recent review in 2017 about the HCT in Fanconi anemia, well, in summary, there's been a lot of progressions and advances, and nearly all patients have a suitable donor today. But still, a healthy HLA-matched sibling donor certainly remains a donor of choice. And gladly, HLA-matched unrelated volunteer donor is the next best alternative. Use of less well-matched donors can still achieve reasonable level of success, in marked contrast to that observed a decade ago. So yes, we have a lot of progressions and achievement with non-related bone marrow transplant, but still healthy HLA-matched sibling remains the donor of choice. So this is where it comes to be the question for you and for us, whether you would like to have a matched HLA baby. Pre-implantation genetic testing allows carrier couples to conceive without facing the dilemma of raising a sick child or possible pregnancy termination. IVF is needed in order to be able to identify and transfer embryo without a genetic disorder, such as Fanconi anemia or cystic fibrosis, and with a specific HLA, which is matched to a living sick sibling who is in need of hematopoietic cell transplantation. It used to be pre-implantation genetic diagnosis, PGD. Now it's called pre-implantation genetic testing, PGT. So now we are talking about PGT-M for monogenic disorders like FA, PGT-HLA for HLA typing, and we talk about PGT-A for aneuploidy, for chromosomal abnormalities, which used to call PGS or pre-implantation genetic screening. So again, now we're talking about PGT, not PGD, and we're talking about PGT-M for FA, PGT-HLA, and PGT-A for chromosomal abnormalities, and all together. Why we want to add PGT-A to the mixture? And I will share with you today my personal perspective of large numbers of couples that I had the honor to assist during the years. When we looked at chromosomal abnormalities, age is a major factor for increasing of chromosomal abnormalities with oocytes or embryos from 30% around age 30 to about 70% at age 43, 44. And the same, it's a mirror image of what will go with the miscarriage rate which increase with age to up to 50% at 43, 44. And unfortunately, the live birth rate significantly decreased during those years. And this is with regular IVF to a very low number. So this is why, in order to increase the chance for live birth, we will add PGTA, PGT for aneuploidy, when we do PGT-M and PGT-HLA. Conceiving a child just to provide a matched bone marrow to cure a living sick child. This is a question that we have today. But the Ayala family, back in 1990, actually did just that. By natural conception and prenatal testing in order to save their daughter who was suffering from leukemia. In 2000, the story of such a unique gift of life had a major turn with the first report on IVF PGT for HLA matching for Fanconi anemia. The first report came from Chicago, from the Reproductive Genetics Institute at that time, with the latest Yuri Velinsky. And here you can see Adam, who was born unaffected for Fanconi anemia, and HLA match after IVF with PGT, and he was matched to Molly, his sister, who needed bone marrow transplant. And I had the pleasure of meeting them 15 years later in Chicago, and actually that in spite of the controversies on the designer baby and saver sibling, the children and the parents had an amazing journey of hope, survival, and happiness. And I'm talking not just now for the Nash family, but for many families that I had the pleasure and honor personally to help them in such a journey. I want to raise a question that will always come up about some ethical, moral issues with regards to PGT, especially for HLA, because I want to raise it, to discuss it with you and put it down. Because right now, it seems that the use of genetic technology to avoid the birth of a child with a genetic disorders is in accordance with the ethical principles associated with physician therapeutic role. And when you talk about specifically for HLA, it is no longer experimental, and it should be offered as a clinical service worldwide. And this is a statement, policy statement by the American Academy of Pediatrics, as well as the American and the European Society of Human Reproduction. And IVF with PGT is ethically accepted to conceive a child that in HLA match to serve as a stem cell donor, regardless of whether PGT is also performed to avoid a severe heritable condition or not. So even if you do it just to avoid leukemia, not necessarily just to avoid also Fanconi anemia, it's absolutely acceptable. Still, we have to remember that it has to be acceptable, of course, for the couples themselves that are going through the treatment. So, of course, there is some may have some religious concerns, any moral issues that can be discussed and resolved. We can do that, and some will decide that this is not the right choice for them. But from surveys that were done, the vast majority of couples will look at PGT as a good option for them. So what would be the current strategy for IVF or PGT? The woman will have to go through in vitro fertilization. So you'll have to take injections for about 10 to 14 days. Those injections are having tiny needles, like an insulin needles. It's not the pleasant things to do, but nevertheless, it's something that you can do. You'll go through egg retrieval when we harvest the eggs, and then we fertilize them with the partner sperm. We culture the embryos to day 5, 6, when now we can look at the embryo. This will be the group of cells that develop to be the baby, surrounding by cells that is going to be developing to be placenta. So we can do a biopsy from the placental cells without significantly damaging the embryo. We take those cells and send it to specific labs that can do the PGT for the FA as well as for the HLA, as well as for the aneuploidy. We don't need to do 3 biopsies. From 1 biopsies, they can test all those tests that we want to. Then we will get the results, and we will know whether this embryo is unaffected, it's normal for the chromosomes, and also it's matched, and then we can transfer the embryo. Of course, it takes time. We also would advise you at that time, after we have done with the genetic testing of the embryos, we can actually focus our attention now on the uterus, make sure that the uterine cavity is normal, as well as sometimes we will discuss the options of doing what we called a mock cycle for endometrial receptivity assessment, so we can actually tailor and like personalized medicine bring the synchronization between the embryo and the uterus to be as high as possible. And we can reach today pregnancy rates between, depends on the woman age, between 50 to 75% in general. Of course, that once we transfer one embryo and it's a pregnancy, it's 100%, but sometimes it's not. So those are the numbers that we can, and we will discuss with you each time. We'll try to set up the expectation because we think it's really important for as part of the care that we provide. Here is actual pictures of an embryo under the microscope. That here will be the cells that develop to be the baby. Here are the cells that develop to be the placenta, and we can do the biopsy from those cells. Whenever we do a procedure in medicine, especially when we do embryo biopsy and things like that, we want to make sure that the children born after that are healthy. So we know now that the blastocyst biopsy for PGT is safe at experienced centers. There's always a possibility of non-significant 1 to 4% loss of viability, but it's a non-significant, and we think that even if you have one embryo, we can still continue and go with the biopsy and with the plan. PGT children have health and development that is comparable with naturally conceived children. Still, follow-up studies are recommended and continued. Family that no identifiable difficulties, and if anything, enjoyed warmer parent-child relationship. There's no increase in congenital anomalies in children born after PGT. And of course, every time you do a genetic testing, there can be a 1 or 2% error rate. So this is something that has to be taken into consideration. And we do recommend prenatal testing while you're pregnant to confirm the pre-implantation genetic testing that was done. Although the first IVF PGT HLA was published in the year of 2000, 13 years later, still less than 35% of the parents of children with Fanconi anemia were offered PGT by any healthcare professional, and only 70% were aware of PGT for HLA as a reproductive option. So in 2015, we wanted to create a clinical guidelines to increase awareness of IVF PGT for HLA matching in order to benefit patients who are in need of a related match hematopoietic cells transplant. And it's a relatively simple guidelines, which we think that can be done all over the world. And we think that IVF for PGT HLA should be discussed with all families when a related match donor is not available. And it should be discussed within weeks of the diagnosis, irrespective of the prognosis. So if unfortunately somebody is receiving the diagnosis that the kid has FA, whether it was done very early or later in the year of 1 or 2 years old, when some of the diagnoses are made, then at that time, the possibility of doing IVF PGT for HLA should be discussed, because HET, doing IVF and pregnancy takes about 9 to 12 months, and we need the HET should be weight, and the mother is to be in reproductive age. 3 to 5 years of age can make a significant impact on the chance of a couple to conceive with their own eggs. And related half-match egg donor or sperm donor may be also considered. And we have published the first case as a proof of concept for such a treatment. And of course, national and/or international collaboration should be established, and the couples that choose this modality should be referred to an experienced IVF and PGT centers. And I had patients that came from all over the world for such a treatment, and it was successful. Here is just to show you the age effect. So if the woman on the outcome of IVF and PGT, so if the woman is less than 35 or 41, 42, HLA match will be 25% of the embryos. But normal embryos, euploid, could be 70% at the age of less than 35, but only about 30% at the age of 41, 42. And if you add also that you need to do PGT-M, then you may end up having only about 13% of the embryos may be unaffected, normal for chromosome and HLA match when the woman is less than 35. But the older we get, the chance to have a match embryo unaffected and normal is much lower, and it can be like 1 in 20 rather than 3 out of 16. Here is a pedigree of the families that came to us from Spain, that they had 2 kids with Fanconi anemia because there was some delay of the diagnosis with the first kid. So only after the second kid was born, the diagnosis was made, and we were able to have the woman had a niece that actually was half matched to the kids, so we could actually took air eggs and were able to create matched embryos and normal, and they conceived and delivered, and both babies had hematopoietic stem cell by now and cured. So we actually implemented a strategy of egg donation to overcome the reproductive limitation, and we were able to overcoming genetic limitation if the donor is not carrying the mutation. So now you can even have more embryos. When we looked at the IVF for PGT, we tried to optimize the treatment, and with adequate ovarian stimulation, individually adjusted based on age and estimated ovarian reserve. And we do patient counseling to have realistic expectation about what to expect, how many embryos will be unaffected, what is the chance for embryo transfer, and the pregnancy rate. So currently, and in the near future, IVF with PGT, yes, this is the options that we have now. Whether we talk about zygotic gene editing, CRISPR, that the systems that you have heard that actually won the Nobel Prize this year, the answer is no. There's a moratorium on that. Further research is mandatory. Recent studies have shown that there is changes in the DNA, not just at the place that we want to do that to resolve the mutation, but also other places, and it may affect the health of the babies. So currently, this is not an option. Some new development, we can take the fluid from the blastocyst, from this fluid that is surrounding by the cell that developed to be the placenta, without even doing biopsy, and maybe even take cell-free DNA from the media itself, so even without touching the embryo. But this is still the accuracy of that is still low, and those are just in the research stage. So at the end of the day, when we talk about PGT for Fanconi anemia and HLA, we would like to put a stamp and say that this baby is healthy and matched. And of course, it's made in the USA. Thank you so much. This is, I thought to bring it to you so you can read of a couple that came to us from San Francisco and went through IVF for PGT for FAA and HLA. And I think that their story is everything that we have talked about today. Thank you, and I'll be happy to answer any questions.